Simon. How are you?
Very well. Had a great game of golf this morning. Quite enjoyable. And yourself?
Steve.
Steve-o, yeah. How are you today?
Good.
He's not good, doctor. He's in a lot of pain. That's why we are here.
Oh, well, this should fix him up for next month.
Thank you, but we are not quite ready to go yet.
Pardon?
Something I'd like to talk to you about. Sit down. We haven't finished yet.
Mr. Jamalski, I've got a lot of patients waiting outside.
I have a lot of patients too, doctor. I have been waiting all morning and having all kinds of sick people vomiting and coughing next to me in your lovely waiting room, which only has Time magazine to read. So just please give me a few minutes.
What is this?
That is all the medications you prescribed my husband. Does it not look familiar?
Well, it's...
It's 35 medications costing us more than $400 a month. And I'm not complaining about that cost, but I have already contacted the pharmaceutical companies to complain about that because I know you do not set the prices. However, what I'm having a gripe about is this. I have done a little bit of research.
Research?
Yes, into my husband's illnesses.
Oh, I see. Googling on the internet.
I haven't finished yet.
I can see where this is going. You come in here and question my years of experience after studying for many years at the most prestigious school in the world. And you think you can find a cure for Steve-o on some absurd American website?
Oh, not just the internet. I have read lots of books.
No. I don't want to hear any more, Mrs. Jamalski. Please, the door's all yours.
The very first time we set foot in this office was in 1985. And on that very day, there was nothing wrong with Steve except he had a headache.
I don't know that. I'd have to check the records.
The point is, you gave him a medication which caused a side effect. And that medication needed another medication. And so on and so forth until today, he's a very sick man.
Well, I think he's doing very well, considering.
All these medications are killing him.
That is a very unprofessional opinion.
Look at him. He's turning into a vegetable.
Steve-o, how are you? Seems to be responding very well.
He can't talk, he can't walk, he can't shit, he can't eat, he can't breathe properly. And worst of all, the Viagra doesn't work.
We can up the dosage on that if you like.
No. Don't up the dosage on anything. Just take it all away, please. He doesn't need these tablets.
What, but take him off the medications?
Yes.
Mrs. Jamalski, you don't seem to understand. He needs these tablets to survive. He would die without them.
I disagree. The tablets are killing him. You are killing him, doctor.
I'm killing him.
The man I married and loved all these years. You are killing him.
That's absurd. You don't know what you're talking about.
All right. Well, you tell me why you are giving him Zoloft.
For his depression, of course.
For his depression. All right. Have you ever read the fine print for Zoloft?
You're not going to read it to me, are you?
The fine print says severe allergic reactions, rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips or tongue, bizarre behavior, black or bloody stools, chest pain, confusion, decreased bladder control, decreased coordination, exaggerated reflexes, fainting, fast or irregular heartbeat, fever, hallucinations, memory loss, panic attacks, aggressiveness, impulsiveness, irritability, hostility, exaggerated feeling of well-being, restlessness, or inability to sit still, persistent or severe ringing in the ears, persistent, painful erection, red, swelling, blistered or peeling skin. There's about 100 more side effects, and then finally, worsening of depression, and then suicide.
Well, it can also be very effective.
Can be. He never had depression in the first place. Well, not until he saw your bill.
I want to see Steve get better just as much as you do.
Well, then explain to me why you are giving him 500 milligrams of Plavix.
It's for his heart.
But there's nothing wrong with his heart.
It's because he's taking something for it.
But there was nothing wrong with his heart in the first place.
Well, he needs it now.
Well, can you explain it?
I don't have all day to explain the workings of the human body.
Well, then I will explain it to you, doctor. You are giving him Plavix for his heart to prevent the possibility of blood clotting, because the drug you are giving him for the blood pressure causes blood clotting, and the drug you are giving him for his arthritis is causing his blood pressure. Now, with all these drugs combined, you are destroying his liver, his bladder, giving him diabetes and psychosis. Am I right?
No, not entirely, but perhaps
I am right.
That's true, there are side effects.
You need to stop this cocktail of drugs.
Very carefully selected. You know, you can always get a second opinion. Steve-O, what's the matter?
He's having a seizure caused by abnormal electrical discharges in the brain. The effect is outward thrashing. There's no point giving him pills now. He'll choke on them. Come on, Steve. Let's go. We don't want to cause the doctor any more embarrassment.
I could prescribe something that will stop the seizures.
Will it cause him cancer or give him a heart attack?
It could, but only a chance of 1 in 5. It's pretty safe.
Safe? You treat my husband like an experiment, a guinea pig. You treat all your patients that way. And I know why. Because the pill companies pay you big dollars. Yeah, you mercenary capitalists. We wait in the waiting room while you play golf all morning. Come on, Steve. We are going. Get away from this greedy, stupid doctor before he kills you.
Stupid? Stupid? I have 4 university degrees.
A thermometer has degrees too, and you know we can stick that, and your prescription too. I'm going to look after my husband now, without these rubbish pills. Come on, Steve. Let's go. A little faster, please. I'm losing patience.
She's right. You know, you should listen to her.
Thanks for coming in. See you next month.